Hey, how you guys doing out there? It's me, Vince Geddes, the health insurance guy, where I help individuals, business owners, as well as families build a better benefit plan than you can find anywhere else. And if you ever had health insurance and you wonder why it's so complicated to use, I'm going to break down 4 steps that every person must know about health insurance. Stay tuned. Now, first things first, you got your health insurance plan, you're happy, but you don't know how to use it. Some people get a little information in the beginning when it's time to enroll, but they don't maintain the information. This video is to help clarify how to use your plan properly. Now, first things first, with every health insurance plan, you have a copay. That is the amount that you pay the doctor. The doctor is in control of the copay. As far as visiting his clinic, he may have a copay in order for you to visit. That is the fee that is payable to the doctor exclusively. Every doctor has a different copay. Some doctors charge $25, some doctors charge $50, some doctors charge $200 or $100. It depends on the doctor's discretion. This is the fee that you would pay the doctor as far as the copay. Now, with your health insurance plan, some doctors, some health insurance carriers pay your copay. Some health insurance carriers pay a set fee. They may pay $50. If the doctor charges $100, that means you have to pay $50. Some health insurance carriers won't pay anything when it comes to the copay. Again, the copay is up to the doctor's discretion. That's the first thing. The second thing is a deductible. The deductible is the amount that you would have to pay first before the insurance carrier pays anything outside of ACA or Obamacare plans. Now, with the ACA and Obamacare plans, they carry 10 essential health benefits which must be covered as far as for those plans. I'm not going to go into the 10 essential health benefits. I'm just going to talk about the deductible because Obamacare plans have deductibles as well. So, for an example, you go to a doctor with an Obamacare plan and the physical is covered because it's part of the 10 essential health benefits. But upon getting that physical ran on you, and let's just say they found something that wasn't right, then you will be paying because the physical was covered, but if you needed surgery, that's not covered in the Obamacare plan as far as being added into the benefit. That's something that you would have to pay for. So let's just say you have a $7,500 deductible, and we know the surgery is going to be a lot more, but let's just, to keep simple numbers, let's just say the surgery was $5,000, okay? But your deductible is $7,500. You think in your mind because you're paying a premium per month that everything is covered, which is not true. You still have to meet that deductible first. And your surgery was $5,000. So that means that once you pay that $5,000, that will lower your overall deductible. So now your new deductible is $2,500. You're not off the hook. It's not like it's free. All right. That's number 2. You will have a deductible. Number 3, a thing called coinsurance. Now, with a lot of insurance plans, once you meet your deductible, you have a thing called coinsurance, meaning that the insurance company, now that you've met your deductible, the insurance company is going to co-insure your plan, meaning that they're going to pay a portion of your bills because they're sharing the responsibility of that bill. So it may be an agreement where they cover 80% and you're responsible for 20, or they cover 90%, you're responsible for 10% of the bill. They cover 60% and you're responsible for 40. That's the idea of coinsurance. And from coinsurance, you have the next step, which is the last step, which is maximum out of pocket. Once you reach your maximum out of pocket, that's when the insurance company covers everything. Some insurance plans have a $5,000 deductible with a $5,000 maximum out of pocket, meaning that once you pay $5,000, everything is paid at 100% up to whatever that limit may be. Now, with Obamacare plans, the good thing about those plans is that they have unlimited limits on their plans. So it could be a $10 million bill and they still have to cover it after the maximum out of pocket is reached. With a lot of private insurance, they have limits on it. It may be $100,000 limit. It may be $1 million limit. It may be a $2 million limit on those plans. So I hope this was a lot of clarification when it comes to how to use your insurance plan, because just because you pay your premium does not mean that you don't have to pay anything else. That just says that you have insurance. That just gives you the ability to go to great doctors, not good doctors. Your body is your body. You only have one body. So don't mistreat it and go to someone who's not qualified to work on the things that need to be taken care of at an urgency. So if you have, migraines, you want to go to a neurologist, go to the best neurologist. This is what you pay for health insurance for. Don't go to somebody that's good. Go to someone that's great, because all doctors are not created equal. I can tell you that many, many, many ways and many times and from many experiences. All doctors are not created equal. So if you are looking for doctors, I'm going to give another tip before I leave. You can go to healthgrades.com, healthgrades.com. It's like a Yelp for doctors. You're able to find out the type of reviews that this doctor may have, the type of accolades this doctor has, the type of medicine that he or she specializes in, how long they've been in practice. It's a really wonderful tool that I use for my clients as well. It's called Health Grades. So again, check that on out. If you are looking for a doctor and you're looking for the best, go to Health Grades. It's a big review on them. But if you are looking for health insurance and you're looking for the best health insurance, you can reach out to me at area code 770-882-6964. That's 770-882-6964. I'm also looking for agents out there, individuals who got their license. They're looking to jump into this wonderful insurance business. Alpha Health Consultants, we are looking to train new blood and bring new blood aboard. You can reach out to me. Again, give me a call or reach out to vincegeddes.com and we can schedule something, and I can find a little bit about you to see if you're a good match for us, and also let you know as far as how we do business and the carriers that we represent, because we have a multitude of carriers that we represent, and we want to make sure that it's a good fit on both ends. Again, if you are looking for health insurance, reach out to me at Vince Gaddis, VinceGaddis.com, or you can reach out to me at area code 770-882-6964. I hope this video was very informative to you. And again, you guys take it easy, stay happy, stay healthy, stay wealthy, and take care of yourselves. Have a good one.